Um, we shall just wait for more 5 minutes and we will start the webinar. Good morning to one and all present here. Thank you so much to join our webinar today, being a Saturday and a weekend. Thank you so much, everyone, joining. And I would firstly like to say that thank you so much to fill out the form and come here to be a part of Anandamaya Wellness Center. I Today we will be focusing on why is hypothyroidism so common. The speaker for today's webinar will be Dr. Gurudutta, founder of Anandamaya Wellness Center. We conduct this webinar every once in a month. So we would like to invite everyone going ahead for all our webinars. Giving a quick background of Dr. Gurudutta, uh, he has completed his BNYS from SDM College of Naturopathy and Yogic Sciences in the year 1996. He has a rich experience in elite holistic health centers like Tokyo, after which he was motivated and started and founded Anandamaya Wellness Center in the year 2004. In Anandamaya Wellness Center, we have a goal of giving and rendering natural healing solutions to the community with specific focus on spending time with patients and making sure of utmost quality in regards of any type of therapies. The treatments and the therapies which we focus in Anandmaya is traditional Chinese medicine, acupuncture, acupressure, yoga, and naturopathy. So here I give Doctor, please
Sure.
take it ahead from here.
Thank you. Thank you, Harshita. Harshita is our marketing team's manager who helps us to deal with several activities of ours in the clinic. I hope you are all hearing me clearly. And if you have any clarifications or doubts during the webinar, you can type it on the chat box. We'll take all the questions in the end. Um, Let me start by sharing my screen. Even before that, most of the participants right now, I can say 50% of them are doctors. Many of them are BNYS doctors, is what I understand. I welcome you all personally. You're all part of my community, professional community. I'm very happy to see you all here, even though I don't know them in person, but I believe they're all part of my community. Just a second, I'll share my screen. Can you all hear me? If there are any clarifications, if you can't hear me, please raise your hand or put it on the chat box. We'll try to see how we can manage that. Hypothyroidism. Uh, it's a very common name these days when compared to earlier days. I still remember when I started my practice way back in 96, 97, passing out of the college, we were finding that hypothyroidism was not so common as it is common today. The theme of today's webinar is also to understand why is it so common. Well, I'll come to those points bit by bit, one after the other. But let us understand that I have named hypothyroidism as sluggish metabolism because that is the base for how hypothyroidism presents, develops, and causes a lot of issues with the one's health. So that's the reason you can say that the other word for hypothyroidism is sluggish metabolism. Another reason why I gave that point is in holistic therapies, uh, which I focus mostly is on traditional Chinese medicine. Traditional Chinese medicine is way old, just like Ayurveda, yoga, and homeopathy. All these holistic therapies have a history, rich history, and legendary things out of it in its practice. Same way, during those times, there was nothing like uh, naming the disease like diabetes, hypertension, obesity, or hypothyroidism, cancer, tumor, and all those things. It wasn't there. It was understood as a state of imbalance in whatever concept. In Ayurveda, it is Vata, Pitta, and Kapha. In terms of TCM, it is yin and yang. It is in terms of chi imbalance. It can be stagnation. It can be excess. It can be deficient. So that's the reason why I mentioned the name sluggish metabolism. Means there is the metabolism slows down. And many of the participants here who are doctors will understand that very well. Metabolism is basically the sum total of all the chemical reactions happening in the body. In the sense, if I require energy, what is required basically is the chemical reactions precursing to the energy is something what the hypothyroid gland is responsible for. Those chemical reactions is called the metabolism. So that is what thyroid is all concerned about. I hope you got the point. I'm sure you would all. Uh, if anyone is, please don't unmute it. I mean, sorry, 1 second. Let us understand in this webinar a few things what is all about. The main points which I'll be focusing about is what is the thyroid gland? What are its functions? What is hypothyroidism? How does it present itself? What are all the symptoms of it? And the main thing is what is the treatment and management? So we'll come into those details as well. And in the last, I'd like to share a few case studies which we have treated purely with acupuncture and no other therapy for hypothyroidism and found very good, fantastic results, the outcomes. I'll share the reports as well so that you'll understand it much better. As we know, thyroid gland is an endocrine gland. Our human system has two kinds of glands, endocrine glands and exocrine glands. Exocrine glands, for example, like pancreas, one part of the pancreas, salivary glands, they're all having a duct for the gland, the hormones to be secreted, the enzymes to be secreted into our system for its obvious functions. Endocrine glands are the one which don't have any duct. They secrete hormones and they directly come into our bloodstream for its target organ to be taken care. And endocrine glands are all controlled by our feedback mechanism within our system, like hypothalamus. Pituitary gland is the master gland which controls all the endocrine glands, and it is directly linked with hypothalamus. I'd like to make this point here is because of the most of the holistic practitioners who are here, hypothalamus is highly, uh, mm, you know, vulnerable, not vulnerable. It is the mind and the hypothalamus are close to each other. That means to say a lot of stresses of the day, a lot of emotions, what we go through in the day to day life can affect our hypothalamus, and hypothalamus can affect our pituitary gland and so different hormones. That's why hypothalamo pituitary ovarian axis, hypothalamo pituitary thyroid axis, they're all parallels. How our mind emotions can work on these glands and thereby change our metabolism, which can lead to a good outcome of good energy and positivity, and also disease as well. Both can happen. So that's the reason we need to understand that how mind and emotions play a very big role. And our therapies, including yoga therapy, acupuncture, naturopathic therapies, because it works on these axes or working on the stress aspect, on the emotional aspect of an individual, it can work on these axes, the hormonal axes and the neuronal axis to make ourselves much better to fight these and overcome many a times when detected early these diseases which comes out of it. And these are all non-communicable diseases, as you know, including hypothyroidism. For example, diabetes, hypertension, cancer, IBS, Crohn's disease, you name it today, what all non-arthritis, autoimmune related inflammatory arthritis, degenerative arthritis, all these aspects are coming out of uh, uh, all these stresses and emotions. And as we say in yoga, Manomaya kosha is the one responsible for the imbalances in the emotions caused in the Manomaya kosha, percolates to our Pranamaya kosha, and that imbalance creates the imbalance in the chi. In terms of traditional Chinese medicine, it is chi. In terms of yoga, it is prana. A imbalance in that further percolates when it persists to our physical body with the manifestations, whatever it is. At the same time, genetic factors are also one of the factors, but I always tell all my patients that don't consider that genetic factor is alone responsible for your diseases. If we are quite good, healthy, and science has proved this today, that if you maintain your health, if you maintain and balance your emotions, those genetic factors cannot be triggered. We have to create an environment for the genes also to trigger to these diseases, whatsoever it is. So that's why we should not take the liberty, I mean, liberty. Tell, oh, I have genetic history, so I am vulnerable to it. That's why I have got this disease. No, that is not an excuse. We have to make sure that if we maintain our health, it's quite possible to counteract that as well. Giving that basis, I'd like to say what are all the important functions of thyroid gland. It's a butterfly-shaped organ in our throat, just below the Adam's apple, what we call it as. If you can, this is the location of our thyroid gland, and it is having two lobes with a bridge, as you can see in the picture. It secretes three different hormones: triiodothyronine, thyroxine, and calcitonin. All three have different functions, and the most basic thing is metabolism. It is responsible for metabolism. That's the reason it is a very, very important gland in our body. Metabolism is sum total of all the chemical changes in the body, responsible for the production of ATP and energy so that we sustain our living to whatever functions we need to be taking, carrying on through the day. Why I'm saying metabolism? Because that chemical reactions are responsible for all the different functions what I have mentioned here. Heart rate, heart function is determined to a large extent by the thyroid gland metabolism itself, because the heart muscles are getting energy through the metabolic activity. That's why heart function can be affected. Digestion, one of the most important aspects. One of the main symptoms of our hypothyroidism is constipation. The bowels doesn't move very easily in hypothyroidism. The reason is thyroid gland and the hormones T3, T4 are responsible for normal digestion. When digestion is good, automatically nourishment, assimilation, absorption, all these things happen. Our energy is produced and we can carry on our normal activity. So when there is deficiency in these hormones, that is responsible for digestive dysfunction as well. And also brain development and nervous system. I was just reading when I was researching for this webinar. It's been a long time. I have gone through my books. It's all the practice what we do on everyday basis. So we keep updating about the new things what is happening. When I was just brushing through a old physiology and pathology books, I found that thyroid gland, even though the symptoms of these are not so visible in hypothyroidism, is also definitely responsible for brain development and nervous system. That's why it has become very important that in pregnancy, for the fetal development and the early infancy, that thyroid hormones are produced normally. It has been found that neuroplasticity, the connectivities between the neurons, all those things we need to be functioning optimally. We need to have thyroid hormones, thyroxine, T3, T4 to be very much there. To that extent, that a recent study has mentioned that in post-stroke, after a stroke condition, they have tried giving thyroid hormone to improve our outcome of the thyroid. The rehabilitation in the stroke cases, they have tried and it has been quite helpful as well. So that way, that's how it is so important for us. And what are all the symptoms, I'll come to it later. And thyroid gland is also, the hormones are also responsible for bone health. Bone is a hard tissue, as we know. Calcium has to be deposited, it has to be removed, resorption should be there based on the levels of calcium required for different functions in our body. And thyroid hormones are responsible for maintaining that balance because it has a direct connection with the calcium deposition and resorption by osteoblasts and osteoclasts. And I also mentioned about muscle hormones are also responsible for muscle contraction. When I say muscle contraction to happen, a lot of things are required. It's the right amount of calcium, right amount of neurotransmitters, signals from your brain and the nerves. At the same time, metabolic activity, which requires energy. Even if all these neuronal activity and hormonal activity is there, we need energy. Energy comes from where? Metabolic activity. So thyroid gland and the thyroid hormones are also very much responsible for muscular contraction. If those muscular contraction, whether it is skeletal, motor, all these muscles, even cardiac muscle has to function well, means thyroid hormone has to function well. So these are some of the very important functions, how thyroid gland helps us to maintain our balance and homeostasis, thereby our goals of life are taken care of. Another important hormone which is secreted by thyroid gland is calcitonin. There are something called as C cells in our thyroid gland, which is responsible for production of calcitonin. Calcitonin is also responsible for bone health and GFR, glomerular filtration rate. That is a function of our kidneys. Kidneys are like filtration factories of our body. It filters all the unwanted and absorbs the wanted biochemicals, including trace elements and all these. So calcitonin has a direct effect on the calcium metabolism and reabsorption of calcium from the kidney nephrons. So calcitonin is very much responsible for that, including the bone health, because calcium metabolism, not just T3 and T4, it's also responsible for bone health, is also responsible by calcitonin. Many of the thyroidectomy cases, calcium is given as a supplement because it cannot be processed without the thyroid gland. We have, of course, we have to take thyroid supplements as L-troxin, thyronorm, but at the same time, calcium metabolism is very much dependent on these hormones. That's why thyroid gland is responsible for so many activities in our body. So now you understand how important the thyroid gland is for us. These are some of the few functions which I have enlisted. There are many more functions. which the science also needs to understand. We have to explore. It's simple. I always tell to all my patients that you may know all the ingredients of an apple, but can you add all the ingredients together and make it an apple in a lab? We cannot, because there is something more than that which we don't know. Same way with our human body, to much more. So this is a gap in understanding which people. So what is hypothyroidism then? Now, as we have understood what is thyroid and thyroid gland, it is very easy to understand. The name itself indicates what it is. Hypothyroidism means reduced function of the thyroid gland for various reasons. We'll come to that later. Because there is reduced function of the thyroid gland, we have what is hypo, the hormones secreted by the thyroid gland, T3, T4, and calcitonin has also reduced, thereby inducing a factor of lowered metabolism and also diminished functions of whatever I have listed above. Do we know? I was just researching what is the incidence of hypothyroidism in our country, in India especially. When you go online and search for it, most of the time you find only US statistics, and Indian statistics is very difficult to find many a times. But luckily, I was able to find one study out of which was presented in 2014, mentioning the enormity of this disease. It's almost 7 years back, 7 to 8 years back, enormity of this disease, and at the same time, what programs has to be done and to get this hypothyroidism managed. One important thing which I forgot to mention is T3, T4 is formed by iodine. Iodine is responsible. Iodine is the one which factor which is very much required in our system for the production of T3 and T4. That's why iodine, iodized, fortified salt has become mandatory in the country because goiter was a big problem. These days, we may not find many cases of goiter. There also, because of lack of iodine, there is reduced functioning the increased function of the thyroid to make T3, T4 is happening, and there is an enlargement of the thyroid gland leading to a lot of complications. So this hypothyroidism is basically reduced production of thyroid hormones, as we know. But we need to understand there are a lot of cases which are subclinical hypothyroidism. In the sense, T3, T4 are more or less normal when you check for the blood test, but TSH is higher. What is TSH? TSH is thyroid stimulating hormones secreted by the pituitary gland. So this thyroid stimulating hormone is very much responsible, which gives indication to our thyroid gland when to increase the production of thyroid hormones, when to reduce. That is based again a feedback from the periphery, from the cells. When there is sufficient thyroid hormones, then the cells tell enough. So thyroid TSH will reduce. Automatically production of thyroid hormones reduce. When there is adequate or excess of thyroid hormones in the bloodstream, if negative feedback goes and TSH reduces. This is a wonderful system of balancing a state of homeostasis in our body. So based on this, when we see in subclinical hypothyroidism cases, we see a lot of T3, T4 being very much within the limits, but TSH going high. That means there is a deficiency. Thyroid stimulating hormone is increased, asking the thyroid gland to produce more and more. That means metabolism has been diminishing for various reasons. I'll come to that immediately after this. So that's why we see that TSH has to be normal. And it becomes normal the moment you start giving Tyranome or Eltroxin to the patient, and it goes, sorry, and it kind of makes sure that it stays there within the normal limits and the metabolism is taken care. Now let us understand what are all the most important causes of hypothyroidism. Now that we have understood what it is and what are all the functions of thyroid gland, what causes hypothyroidism? That's the most important thing. Why is it so common these days? I remember way back in 90s, late 90s, when we used to go to obstetrics and gynecology internship, uh, checking for thyroid was not such a mandatory thing, including the blood sugars or hypertension. You check on a regular basis, but it was not so important as today. But today, it happens that every lady who conceives, we ask them to get a thyroid function test done. Why is it so? Because it has become so common. Why is it become so common? I would say four important factors there. The most important factor or major factor is lifestyle, and we all know why it is. Next comes autoimmune. Many people, many scientists and medical professionals think or of the opinion that hypothyroidism is mostly autoimmune. I would say autoimmunity is also one of the outcomes of our bad lifestyle. And the last two, congenital cases. By birth, there are defects in the thyroid gland. That's very, very minimal and very few cases. I haven't seen any cases of those congenital conditions at all. Fourth one is certain medication. I've seen a couple of cases who are suffering from bipolar disorder, depression, who are on lithium. Lithium for many years has also caused severe hypothyroidism and all those complications leading to increased symptoms of depression and bipolar disease as well. Let me focus on this lifestyle factor a little more based on my experience, what we have seen in our clinic. What is the lifestyle? Everybody is talking about good lifestyle, good lifestyle. So, what is bad lifestyle? What is good lifestyle? Very simple. Follow nature's principle. Maintain homeostasis and balance in your emotions. That's your mind, manomaya kosha, with your breath, the pranamaya kosha, that is chi or prana, balance of that, and annamaya kosha, your physical body. If you maintain these three with our nature's principle, nature's cycle, nature's time cycle or rhythm, automatically that's a good lifestyle. In the sense, eating at the right times, sleeping at the right times, exercising adequately, because human beings are not meant for inactivity. They're meant for activity. The more you sit, the more you work in that factor of sedentary lifestyle, that causes what is called a stagnation of chi and eventually leading to deficiency of chi also in terms of TCM. You believe it or not, studies are coming out these days that inactivity or sedentary lifestyle is one of the major causes of low grade inflammation in our system, leading to a lot of lifestyle disorders, non communicable ones. And it is getting proved day by day that it is very clear that human being is designed for movement and not for sedentary lifestyle. So any factor which is offside, which is off route of this nature cycle, can lead to lot of diseases. Then you may ask me a question. If that is the case, so many people are dealing with this kind of sedentary lifestyle, why everyone is not getting this kind of diseases, including hypothyroidism? It's very simple. It's based on the amount of bad lifestyle they are doing it, whether they're smoking, drinking, are they consistent enough on the bad lifestyle as well, how frequently they do, how they are exercising, how are their sleeping habits, how are they managing their stresses and emotions. It depends on each individual to individual. And at the same time, how is our vitality? Vitality is very, very important. That is what we call, we maintain the vitality is the inner core strength of our own self, which you may call it as immunity as well. So which will help us to maintain a good lifestyle. I mean, which will help us to maintain our day-to-day functions with a lot of vigor and energy. So each one has different vitality based on their state of mind, body, work, and family situation, emotions, and all those things. That's why each one will get affected at various times. And that is also the reason why genetic factor comes into picture. Genetically, if we have a strong vitality, which we have inherited from our parents, maybe we'll have larger window not to get these diseases even if we have a bad lifestyle. So it depends on individual to individual very clearly. That's why lifestyle is a very, very big factor, and which has become very sedentary these days with high stresses, high expectations. Those are the things which are causing our thyroid also to overfunction. In the sense, metabolic rate goes up. See, automatically, when you have a lot of mental function, less physical function, the need for energy is also increased. You may observe that most of the time, I remember still my parents had maintained 2 meals a day. Now, sometimes we need 4 meals a day. Apart from 3 meals, one snack meal also in between lunch and dinner. Why is that so? Because we are spending so much of time mentally that brain requires constant supply of blood and glucose that we crave for quick fix of glucose. So that means metabolism has to happen. If the moment you take glucose inside, it is not reaching your brain, right? Thyroid hormone and different functions has to work, release the energy, and that needs to be supplied to our brain for its functioning. So same way, metabolic rate goes up. When the metabolic rate goes up, more and more thyroid hormones has to be secreted to maintain that. So eventually, when that is the case, it can lead to hypothyroidism or TSH being high, subclinical hypothyroidism happens. And if you don't have sufficient exercise happening, what will happen is you're gaining weight. You're eating adequately or more than that. Overeating leads to gaining weight, converting all the carbs also into fat. And more number of cells means more metabolism. That means more thyroid is required. So it is a vicious cycle which happens. That's why the most important factor I would attribute for hypothyroidism is lifestyle. Now, I'm sure you must have understood all these factors of what are all the causes for the hypothyroidism. Next, let us go. How does it present with? How to identify hypothyroidism? Most important factor is look for the thyroid gland. Is there any swelling? Is there any hoarseness? Sometimes suddenly I develop a little bit of hoarseness in our voice. Is it because of that? We don't need to be over sensitive about small. We have to differentiate whether it is because of sore throat or any other infections or weather changes, all those factors. If there is a consistent hoarseness, then you'll have to think about that as well, along with the other symptoms what is mentioned here. Weight gain, that's the most important factor what we have to look for in hypothyroidism. Apart because of lowered metabolism and sedentary lifestyle. Fatigue, because there is lowered metabolism and the brain function also diminishes in hypothyroidism. We feel a kind of lethargic feeling and no interest to do whatever we want to do in our day-to-day living. We just try to procrastinate, postpone things. Oh, let me do tomorrow. This is something which I ask every person these days. Do you procrastinate? So tending to postpone things, that is also one of the important symptoms. And the heart rate variation. As I mentioned, thyroid hormones are responsible for heart functioning, slowed heart rate. And elevated blood cholesterol level is also another factor. It can be genetic. It can be, as I mentioned, lifestyle is a major factor for elevated cholesterol, lack of exercise, stress, and leading to atherosclerosis, hastened atherosclerosis, and deposition of cholesterol in the blood vessels, leading to hypertension as well. So elevated blood cholesterol levels, and because of lowered metabolism in thyroid, that is another factor, another symptom or sign we have to look at. That's one of the signs. Muscular weakness, muscle aches are all responsible as well. And one more important aspect is this factor is still not very clearly understood by science yet. But I did mention briefly previously that hypothalamo-pituitary ovarian axis, hypothalamo-pituitary and thyroid axis, they're like parallels. It has been found that even though there is no direct connection between ovarian hormones and the thyroid hormones, but when there is hypothyroidism, there are changes happening in the women who are suffering mostly from hypothyroidism, leads to changes in the menstruation as well. It can be oligomenorrhea, that means reduced flow, or it can be irregular menstrual cycle, or amenorrhea also, no menstrual cycle for many months. These are all the presentation it can come to. And I also mentioned depression and impaired memory because thyroid hormones are responsible for normal brain function as well. And because of sluggish metabolism, which is in hypothyroidism, we also find constipation to be a major factor because the bowel movements and the peristaltic movements are not normal. So it needs a stimulant. It can be through a coffee or a smoke or whatsoever it is. It needs a stimulant. Sometimes many patients tell, I don't have my bowel movement as soon as I wake up in the morning, but after my breakfast, immediately I feel like going. What happens with breakfast? You are stimulating the peristaltic movement. You have had your food, so the bowels will start moving. Let us understand bowel, the intestines are not static. Just like a heartbeat, even the intestines have to move for the function to happen, for the food to move and digestion to happen, stools to be evacuated. So that's why constipation is a major factor. Enlarged thyroid gland, I already mentioned. Joint pain, stiffness is also one of the symptoms of hypothyroidism. Hoarseness, I have mentioned. Dry skin is also another factor which is an outcome of hypothyroidism. We have to look out for that as well. Hair loss, thinning of the eyebrows, puffiness under the eyes, facial puffiness. They're also factors because of lowered metabolism. Some of the signs which we have to look for when the patient walks in, we should be able to recognize that. And most importantly, we have to not forget asking our patients about hypothyroidism is cold sensitivity. Because of lowered metabolism, the generation of heat is reduced. So I become very sensitive to cold because my temperature in the body may be a little lower, extremities being cold. So a cold weather, cold environment can make me more cold. That is another symptom which I have to look out for. Now, what is the solution? Now we have understood the problem, how it happens, what are all the factors, what are all the causes. But now let us understand what are all the solutions. A good lifestyle, return to nature's principles. That is the answer for today's hypothyroidism. I'll come to that a little later. When extreme cases of hypothyroidism comes in, we don't have any other means. Probably we have to go for external medication. Is it enough for me to take external medication in the form of L-toxin and thyroxine and stop at that? No, not at all. Along with that, it is like a simple analogy that a person who is limping, if I give a crutch to him, he'll forget walking eventually. Same way, if you give an external medication to your system to support, automatically over a period of time, the body responds in such a way that I am not able to produce my own hormones. So it cripples the function of the thyroid, is my strong belief. And also what happens is there is a leniency or negligence on the part of the person when external medication is there. All my symptoms are under control. Oh, why should I exercise today? Why should I eat this way? I become lenient. So that is another reason why dependency on external medication increases. Because your thyroid is not functioning, you're supplementing from outside, you're diminishing the function of the thyroid gland. So automatically, body has to fight so many things. Uh, uh, that's the reason why we become lenient. The moment we become lenient, we want more of medication to come in. They start with 25 mcg, go up to 50, 75. I've seen people going up to 150 mcg. Just imagine, from 25 to 150 mg. Why is that happening? Because of this. So in severe cases, I am not against the external medication. External medication is required. Parallelly, internal correction and balance of thyroid physiology is very, very, very important. How do we do that? Healthy lifestyle. Healthy lifestyle. That's the only answer. Exercise regularly with a proper guidance from your doctor or a physiotherapist or a yoga therapist or a yoga doctor. Take sufficient advice for them because there are certain asanas, practices which are responsible, which will help you to work on the thyroid gland indirectly. Don't go with the assumption that in yoga, I do certain asanas, automatically my thyroid gland functions. It acts as a stimulant and my thyroid gland becomes normal. Not necessarily. In yoga, if that is the answer, then we'll have many asanas specifically for different diseases. That is not possible, is my belief, because yoga as a whole is effective because it works on your body, breath, and mind. That's the reason. Make sure you drink sufficient water through the day because dry skin is very, very common in thyroid cases, hypothyroidism cases. Make sure that sufficient water means sufficient hydration is very, very important to keep ourselves away from the dry skin, because dry skin can lead to vulnerable situations of getting infections easily for us, because skin is the largest organ which is responsible for protection from external factors, including weather and pathogens. And also make sure you have sufficient air and ventilation. Sunlight also has to come. If thyroid has to function to its target organs, the bones, and all those things, calcium deposition, maintenance of calcium in the bloodstream, we also need vitamin D for bone health. So that's why getting sufficient air is very, very important. And not just that, sufficient air with sunlight will also have a lot of positive effect on our mind. We feel refreshed, we feel energized. That's why sun bath is very, very important. We in naturopathy advocate sun bath irrespective of whatsoever it is, whosoever it is, whichever condition, unless there are some contraindications in certain situations. So we need to make sure that we are in day-to-day living in our home itself, we have sufficient sunlight coming in. These days, being in the pandemic for the last 2 years, we are all homebound, not getting exposed. Our buildings and apartments are designed in such a way that not much of sunlight enters. We are in the artificial light, or even in offices, we are in the artificial light. So most of us are vitamin D deficient. Vitamin D can have a big impact on our immunity, calcium metabolism, can also have an indirect effect on our thyroid metabolism, thyroid functioning as well. And eating sufficient vegetables is also very important. I'll not go into the details of that because based on traditional Chinese medicine, thyroid hypothyroidism is considered as spleen energy deficiency. In spleen energy deficiency, we don't advocate too much of raw vegetables. We advocate cooked vegetables and larger portions of cooked vegetables because it's semi-digested already. And getting sufficient sleep is very important to balance our hormones, especially cortisol, adrenal gland, adrenalines, all these aspects. When it is in normal levels, we are much better. When cortisol increases, metabolism increases. Then the need for thyroxine also increases. That's why make sure you sleep at the right time. Many people are of the opinion that if I'm getting 8 hours of sleep, how does it matter? No, it does matter. If that is the case, those who are all working in the night shifts are supposed to be equally healthy than to the people who are in the day shift, which is not the case generally. If you can observe it, you will understand it is not the case. So that's why sleeping at the right time is equally important. And staying mindful. Staying mindful will help us to balance our emotions, which will help us to stay ourselves calm. We are much more aware. We are much more aware of our things happening around us. When we are aware, that is the half solution for managing our stresses. So these are some of the things which we have to take care in maintaining an internal correction to happen for the thyroid, not just the external factor as I mentioned. Now let us go acupuncture and hypothyroidism. In acupuncture, what we do at Anandamaya Wellness Center, in a detailed consultation, we try to understand what are all the imbalances in the chi. It can be chi stagnation because of a lot of sitting and sedentary lifestyle. It can be because of deficiency, or it can be because of excess. But mostly in hypothyroidism, it is because of stagnation and deficiency. Which are the causes? Mostly it is spleen energy deficiency in hypothyroidism cases. Acupuncture, as you may all be knowing, is inserting very fine needles into specific points on the meridian, which is responsible for homeostasis. All the meridians has to function normally to have a good health or a state of homeostasis. Acupuncture, when needle is inserted into the specific area in a specific angle and depth, we clear that stagnation. We are clear when the stagnation is taken care of, deficiency is also taken care of. Thereby, there is a state of balance leading to thyroid becoming functioning better because of spleen energy becoming better. In terms of 5 elements, earth element is the one which is responsible for deficiency or imbalance in the earth element is responsible in terms of TCM for most of the cases of hypothyroidism. So we choose points which is responsible on those element, on that earth element and the meridians concerned with that. We take the picture of the tongue, analyze it, explain the patient what is the imbalance in you, how long we have to require therapy. It varies from individual to individual. If they come in a very early stage, probably 2 months is enough to take care. After that, it is a follow-up and maintenance therapy. For some, it may take 6 months if they are already on medication and a long history of hypothyroidism with a genetic factor also being there. So it varies from case to case accordingly, but we have found excellent results, which I would like to share. So this is one of the cases where the name I have masked it. Can you see the TSH levels? We started this gentleman who is 47-year-old. We started in about December 2020. We started at that point of time with for treating his hypothyroidism. He's a very well-known, good-known person to me. So I asked him, "Are you taking medication?" He didn't want to take medication and he had not started, even though his doctors had recommended you have to start with medication, but he didn't do it. And when we started in December 2020, you can see that how it has progressed later, 5.87 in June, and again in September 2021, it came to 4.31. So that's how improvement was found in his situation. You can see even the T4 getting better and T3 also almost being in the normal levels. One more case. This is a lady who was 62-year-old. Fantastic outcome in her situation. When we started this therapy in somewhere around May, June 2021, and we did it for about 3 months, her TSH was 6.31 when we started. And at the end of, you can see the dates, July to November, we found that TSH being 2.57. So thereby we can see a lot of improvement happening in such situations. Means we have purely dealt with acupuncture based on traditional Chinese medicine. We have been consistently doing therapies for them, and they've also cooperated in terms of taking care of the internal correction, what I was talking about in terms of lifestyle. Apart from that, they have not taken anything else. One of the cases as above, they have not started medication. The second case which I have presented has been on medication, and her doctor told that now that your levels are better, we can think about reducing the medication part as well. And one more case, very old case, which I have not presented here though. She actually came for a different complaint, and we started treating for that, especially for her back pain and also for hearing loss. All those things we started treating with acupuncture. She is also diabetic and hypertensive. I used to use some points for that as well in acupuncture. And when she went back to her doctor for a different complaint, and they asked us, her to check their thyroid levels, actually the thyroid levels were, TSH was way below normal. So she told, please stop the medication as early as possible. It was found by accident. They didn't go for that particular test for understanding. That's how several cases have got help. And we've also followed it up to see that it has maintained. I don't have the reports of that, but they have maintained more or less with the same levels after we stopped the therapy as well. If you have any questions or queries, you're most welcome. I can stop the screen share now. If anyone has any questions, you're most welcome to ask. End it with that much. I hope you have understood most of the things what I have tried to explain. Anyone having any questions, I'm open to it. Thank you. Looks like no one has any questions as such.
Yes,
There are no
doctor, I
questions.
was
It
just
means
checking
that
that.
either whatever I've tried to convey has been understood very well or not understood completely. I believe that you all understood very well
No,
and
doctor.
you don't have any questions for the same reason.
I'm sure, doctor, you were
Well, in
very
that case,
clear
we
enough.
can
I'm
end it, Harshita, because there are no questions.
Yes, sure, doctor. If at all anyone has any questions, you can definitely uh, visit our social media channels and Facebook or Instagram,
Okay,
or else you
I'd
can
like to
also
end this
visit our
webinar
website.
today. I would like to thank personally all of you for sharing your valuable time. Take out your time to uh, uh, in your busy schedule on a weekend. It's a valuable time for everyone. Would like to keep you mentioning that we conduct webinars every month, uh, uh, one of the Saturdays at 11 a.m. on different subjects, different topics. You can always give us suggestions. What would you like us to talk about? And we also have a YouTube channel, Anandamaya Wellness, wherein we upload every week one video about health, well-being, and disease management through natural healing solutions. I request you to subscribe to it and share among your peers, friends, and relatives so that the information reaches them. Because many a time, right information at the right time can save someone from a grave problem. So it is very important for us to share information, but we don't want to spam anybody for that reason. Sorry, there was a small disconnection happened. I have some. Uh, Arjun Achar has asked me, could you please mention about the specific acupuncture points for this condition? It varies from person to person, Arjun. I mostly do with spleen energy, SP6, SP9, REN23, ST36, and also I work on liver channel for this, liver 2, liver 3. These are the ones which I generally use. But based on the outcome and the imbalances what I record through the consultation, I then come along and make the points, which varies from individual to individual. It is not a standardized protocol. Right? I think there are no more questions to be asked, so we can end the webinar. Thanks once again, and see you soon next month for another topic. We'll share our webinar topic and the link to sign it up for that on our Facebook page, and also probably because you're all in our phone book right now, we'll share our webinar details personally also on your WhatsApp so that you can sign it up for. Thank you. Have a good weekend. Have good health during the pandemic. Maintain immunity and make sure that you're away from this pandemic as far as possible.
Thank you, doctor. Thank you, everyone, for joining the